Indeed, the figures are going up. We now have, according to the NCDC, 100,087 cases with 1,024 new infections. Deaths are now at 1,358. And increasingly, there are people that you and I know. You hear, oh, this person was admitted yesterday, or this person was discharged, or, it's now a relative, it might be a distant relative, it might be a friend of a friend, it might be, increasingly they're becoming people that we know. And, we've been told about a second wave with a virus which seems much more virulent than the first. And there are talks of a vaccine, also coming to Nigeria. Where are we in all of this? You also heard there in the last report threats of a second lockdown if the rate continues to go up, if the death rates become significant. What will constitute significant? We have this morning with us Dr. Mamora, who is the Minister of State for Health. Happy New Year to you, and welcome to Sunrise Daily.
Thank you very much. Same to you. Happy New Year.
Sadly, though, a lot of people were not able to say that, and sadly, we did not leave COVID-19. In the old year, it managed to make the crossover, like, many Nigerians did. What are your concerns when you look around today as Minister of State for Health with a pandemic that has been on for quite a while now? What are your concerns as to where we are?
Thank you very much. Well, I'm worried about the attitude of our people generally in terms of non-compliance with the advisories issued, particularly in respect of non-pharmaceutical interventions. You go out there, you still see a lot of people who appear not bothered in terms of their attitude, not wanting to use the face mask, or where the face mask is used, it's inappropriately applied. It's turned into chin mask, or even head mask, or neck mask, and not what it should be. And of course, you still see people in large gatherings. People still party as if nothing is happening. And yes, in a few states, you see the state governments trying to put in place some enforcement measures and all that. So that is that. Of course, the rising figures is of huge concern, and not just the figures rising, deaths that we are recording on daily basis now. And some people tend to feel that, oh, it's the big people. Yes, it's the big people that you report most times. And, I think Shakespeare wrote that when beggars die, you do not see comets. So the tendency is that it's the death of the big people that will attract, attention more. But he who feels it knows it. But people are dying.
I'm going to ask you to hold your thoughts, because you're a member of the presidential task force, and, for every single change you see in terms of attitudes and behaviors, and also even in terms of the change of the virus, I want to believe that there's a strategy, there are thoughts in terms of how to tackle it. We'll come to that when we come back from this break. Please stay with us. Dr. Mamora is our guest. He's the Minister of State for Health, and we're talking about the second wave, COVID-19, increase in infections, and of course, increase in deaths. And, what's going to be done about that, especially in the light of vaccines that should be coming to the country. We don't know when, but he's here and will give us a little more insights as to when that will be expected. But let's talk about you know, what the thinking of the Presidential Task Force is, seeing what is happening, looking at the nonchalant attitude of a lot of people, seeing that, you know, we seem to have, we're no longer afraid of the virus, so to speak, even though we have been told that, you know, this second wave, this virus seems to have mutated and we have a more virulent strain. What are the thoughts of the Presidential Task Team as a look at what is currently obtainable?
Well, essentially, what the PTF is looking at is to continue our advocacy to the people through the various strategies, using the media, using the community leaders, the religious leaders, the various groups, and doing what we call risk communication.
You must admit that it could get boring. I mean, in the early days of the pandemic, almost everybody was tuned in to the COVID, to the Presidential Task Force. Every time they had a briefing, they wanted to know what was new. There were loads of questions, I'm sure. Oftentimes, you couldn't even take everything in front of the cameras, and you had to limit what you could take from reporters. Isn't that correct? And then as time has gone on, you know, with the pandemic gone on for so long, it was seen that people are exhausted. They're tired. It's like they want to move on with their lives. How do you begin to say, hey, guys, yes, we admit that this could get tiring. However, the virus doesn't seem to be tired. If there's anything, it seems to be reinventing itself. How do you think that the Presidential Task Team, or force, if you'd like, can reinvent itself in such a way that Nigerians take note again of some of the things that it is saying to them?
Well, I agree with you that it could be boring. But then what do you do under a situation that you still don't have a cure and the vaccines are not readily available? So you are forced to keep with what you can stay with, which is these non-pharmaceutical interventions.
Do you think that there are more aggressive ways that these non-pharmaceutical interventions could be applied so that people, you know, are more conscious of it? If they would not do it for themselves, then they are forced to do it for others?
Well, yes, but again, you have to think it through. What do I mean? It's either you want to go by the route of lockdown, which we are trying to avoid as much as possible because it has its, call it collateral damage when you do lockdown. You know what is happening in UK now, where government has been forced, as it were, to implement another lockdown. And so it's also, I mean, similar thing is also happening in some other countries, you know, over there. But we are very conscious of our own situation. What we are trying to do is to have a kind of delicate balancing between lives and livelihood. So that is that. Now, you can also implement or introduce some punitive measures. You know, yes, you recall, I think just over the weekend, where the government of Lagos, you know, officials had to go into some nightclubs to really get people arrested. You know, so these are some of the things that we can do. That is, we try to put in place enforcement. But again, there is also a limit to how much of that, because if you get people, where do you keep them, particularly if you apply sanctions, maybe by way of pains, some penalty, fines and all that. How about those who cannot pay? Where do you keep them and all that? So there are lots of issues, and it's still, the best thing still remains advocacy. in terms of voluntary compliance. Because, look, keeping yourself safe as an individual, you take it as a primary responsibility on yourself. And every other person has to do it that way, so that you can also, others can be safe.
Do you think that the kind of advocacy needs to change? Let me give you an instance. For cigarettes, for a long time, we're just told, you know, smoking is dangerous to your health, smoking kills. But we've seen over time the messaging for cigarette labeling, you know, has since changed. In some instances, in some countries, they're required to put the damage that is done, you know, by smoking cigarettes to the organs of the body that it affects on the packets of cigarettes, hoping that that would deter those who, especially those who want to start smoking, for instance, and even those who are smoking would seek to stop the habit. And that's, you know, as a result of, you know, re-strategizing, so to speak. Do you think that our messaging has gone through a reinvention, considering the fact that, you know, people are now beginning to throw caution to the wind, even people who had been cautious before?
Well, part of what we're doing, which I want to commend the media, is carrying their cameras to the wards in various hospitals and seeing the real life experience of these patients, and showing that to people to see for themselves. Again, we are encouraging a lot of people to come out, particularly those who have been lucky to go through the experience and share their experience from personal, you know, exposure. So these are some of the other things that we are trying to do so that people can see, because I feel so bad when I hear some people still living in denial or in self-delusion somehow, saying COVID does not exist. So we are showing these things here. We're encouraging more and more people to come out, particularly those who have been lucky to get over it, to share their experience. So that's part of what we are doing, so that people can really know that this thing is real. And individuals must keep safe by implementing the advisories which we have pushed out there.
Let me take this to Lagos now. Ayo, you have questions for the minister?
Yes, Malfoy, thank you. I was just wondering, Dr. Mamora, you know, perhaps part of the messaging, part of the challenge of the messaging is in whether or not we take any action to improve on our infrastructure at the local levels, so people can see that government is actually doing something to not only validate that this is real, but that to make sure that we actually are doing something to ensure that you are taken care of. You know, if you take precautions, you know, that's fine. For instance, at the beginning of all of this, we heard, you know, the PTF chairman say that he didn't know that we had such huge infrastructural deficit at the primary healthcare level. So perhaps if there was activity at the local levels, at the PHC levels, at the various wards or local governments all over the country, maybe people would see that indeed, because of this seriousness, government is doing something, and consequently, it is easy to believe. So in terms of infrastructure upgrade to fight this and other diseases that may happen on us, has there been anything significantly done to prove that indeed government is working to ensure that we nip this in the bud as quickly as possible?
Well, we have been doing a great deal of that through the National Primary Healthcare Development Agency. They have put in place committees at the ward levels that move around to engage in advocacy on the issue of COVID-19 pandemic. And of course, in terms of infrastructure that you mentioned, yes, I know that our hospitals, particularly the federal tertiary hospitals, the federal medical centers, and the teaching hospitals, because these are the places where most of these patients end up with. A lot of them will have been at the maybe private centers or private clinics, private hospitals. The tendency is always for people to say, oh, it's malaria. But when it becomes obvious, particularly difficulty in breathing at a high level becomes obvious, then naturally they will be pushed to the public hospitals. And one of the things we are doing right now is to ensure oxygen supply, because that's a major component in the management of COVID cases. So we are encouraging all the hospitals to ensure that oxygen supply is sustained, because it's a major component in the management of these cases. So that's a major thing that we are trying to do, and we are collaborating with the states themselves so that in their general hospitals and other centers that have been opened for the isolation centers and the treatment centers in the various states, they would see the need to ensure that these things work the way we want them.
Okay, well, one other thing that, of course, is part of the solution that government has been proposing or been looking at is the information about the vaccine. The information out there was that before the end of January, the vaccines will be in, and then there's another, word out there that it's not going to happen anytime soon. Just exactly where are we on that one, so we can take on some other questions.
Well, the truth is that still many rivers to cross, I must say. Is it because we don't produce any of these vaccines, so we are relying on the countries where these vaccines have been produced. But what we have done, I mean, in spite of all that, that does not mean we are folding our hands and not doing anything. We are part and parcel of the COVAX facility, which is a global body trying to ensure that vaccines are made available and made affordable to the low and middle income countries. And this is being facilitated through Gavi. Gavi is the Global Alliance for Vaccine and Immunization. It's a world body as well. And we are also engaged, of course, WHO is also involved to ensure that there is equitable distribution of these vaccines. So we are part of that global body. So when the vaccines are available, then we have our own share, and we have been, we are sure that 20% of our vaccine need will be made available to us free. And then we will then provide additional 20% at least in year 2021. Of course, we will also provide for the operational cost, because it's just the vaccines that will be supplied. But in terms of operations, because you need syringes, you need the personnel, you need everything to get the vaccines to the people. So the issues of availability, accessibility, affordability, all these issues are still there. Even the issue of accessibility, because even with the vaccines not yet being available, some people are already showing what we call vaccine hesitancy. So what we are now doing is to start some kind of advocacy, even when the vaccines are not available. Let's prepare the minds of the people that this is the way to go. We will have no choice than to go for this thing. So we have commenced that, particularly from the lead agency, which is the National Primary Care Development Agency, because that's the lead agency.
Yeah.
And
but you haven't answered the question. My apologies.
When I say
my apologies,
evaluating,
Honorable
we are
Minister.
looking at the factors.
My apologies. You haven't still told us in specific
vaccines.
How soon are we expecting the vaccines to get here? Because just as you said, the people are not taking on to the non-pharmaceutical interventions, and perhaps the vaccine would be the last solution. So how soon are we expecting, just to be clear?
Well, you see, whatever I say is it could just be by way of projection. Maybe it may by February, because we don't have absolute control on these vaccines. So we are also looking at what we are being told from those who are making the vaccines available. And we are not restricting ourselves to a particular one, but we will have to look at the realities of our own situation, because you talk of some of these vaccines that you need to store at a temperature of about -70. So the tendency is for us to want to look at the ones that we can easily manage, that is between a temperature of +2 to +8, which is within the range of the routine vaccines that we use for the childhood vaccine-preventable diseases, that is polio, measles, and all that. So we have facilities on ground to cope with such. So we will look at all this, and then we'll look at the cost element as well, because the vaccines are not free. We have to buy them, and the funds will have to be there for us to be able to. So it will be difficult for me to tell you that we are expecting the vaccines next week or 2 weeks.
Well, the PTF has been talking about, getting a hold of 100,000 vaccines first. We also saw reports of, the president and the vice president to receive the vaccines on live television. I think that report came out last week.
They would.
Yes. So, and then we're also saying here, I'm sure a lot of people, when they pick up the Vanguard, we're wondering where this is from. Frontline workers, adults, uniformed personnel, high burden states, top priority list. 84 million plus Nigerians to be vaccinated in first quarter. First quarter of when? Is it first quarter of this year or next year?
First quarter of this year, definitely. First quarter, that's between January and March.
We're hopeful that we would actually be able to get up to 90 million vaccines supplied to Nigeria.
These are projections. These are projections, because we have to, you make your planning, and then you make your projections.
Projections based on what? I mean,
projections based on some of the things you've read out. That is, who are the people that will be targeted first? Priority groups.
No, projections, the projections I think will concern a lot of people are projections as to where we're getting the vaccines from, because we know that right now, for a lot of the companies that are producing, they have even been bought upfront by the countries that are capable of buying. So are we confident that based on the companies that we know have been able to produce vaccines so far, we'll be able to get 90 million for Nigeria in the first quarter of 2021?
That is why I told you that we are reaching out. We are not restricted to a particular. There are so many vaccines available, but we will look. You see, the process of getting these vaccines is not such that we will just go there and start procuring. Even when the vaccines are available, they have to come here and be certified by NAFDAC. So it's a whole lot of process. NAFDAC has to, certify the vaccine and say, yes, we are good to go. And don't forget that all these vaccines that you have available being used now, they are being used under emergency use authorization. So that means if some of these companies already, they are also talking of indemnity, which is being guaranteed by some of the countries. That's also another. To
be indemnified just in case things go wrong.
Yes.
Just quickly, though, you have talked about complacency on the part of Nigerians. Some people will say that at some point it looks like government itself has also encouraged this with the policy that it puts in place with NIMC registration and all. A lot of Nigerians trying to get their NINs, who do not have them, so that they can link them with their telephones, considering just how important that linkage is for them. I'm sure you've seen the mess that has happened in a lot of registration offices. Even at some point, members of NIMC staff saying they're going on strike because their members have caught COVID. How is that conversation going on with the PTF and the ministry involved?
Well, the information available to me from the officials of the Ministry of Digital Economy and Information is that it's the people themselves that are not complying with the directives. Because ordinarily, they were supposed to get these things done online. And people were supposed to be invited so that the process can be better managed. But people just feel that they can just go there and start getting things done on their own. So my appeal is to everyone out there to try and comply. It's still the issue of compliance. That people are not complying with the directives issued them as to how the process can be managed. That's what I'm getting.
Let us go on break now. When we come back, we'll ask, isn't it the job of government to ensure that people comply? When we come back, please stay with us. It's our closing moment with Minister of State for Health, Dr. Mamora, and we're talking about the policy of government, because sometimes it does appear that is government working at cross purposes? On the one hand, they're talking about social distancing and, compliance with COVID-19 protocols. On the other hand, it seems we issue a policy that sees a mob, let's say a mass of Nigerians besieging the offices of the NIMC, saying we want our needs. And we're asking, how do we proceed moving forward? We have since seen that this is what we have on ground, either by, maybe not intentionally created, but this is what we have now seen has come out as a result of it. What do you think should be done moving forward to ensure that the people are protected and also their lives are protected, which ultimately is what this linkage of national identification number with phone cards or with SIM cards is supposed to do? How do we ensure that we are able to accomplish that while at the same time not endangering the lives of Nigerians in a situation that is already endangering enough?
Well, I can understand nobody feels good. I don't feel good looking at this kind of picture where people are gathered in multitudes and, it's like a super spreader event, which we don't like. But I'm also aware that the relevant ministry, which is, communication and digital economy, is looking at this. My understanding is that the whole process may be suspended so as to reorder the whole process in terms of management of the crowd, because it was never intended that it will become a rowdy process like that. So people may have to wait and be called at intervals to go through the process if they have to be there. But I also understand that ordinarily this is something that they're supposed to do online without even necessarily going to these centers. But whichever way, we have a duty as government to ensure that people are protected. But we also have a duty to ensure that people comply, within limits of what is good for the society at large.
How often, are we looking forward to a PTF briefing today?
Well, it depends on, again, what programs, because there are times you have competing programs. Like we'll be having the breakdown of the budget today, and that may be which we're also supposed to participate in. So that may not, if you don't have a briefing today, we definitely have tomorrow.
All right, it's a fine place to leave it. We'll encourage Nigerians to look forward to that briefing. Let's not be tired of, listening to what it is that has to be said there, because it's one of the ways that we get the latest information on COVID-19, especially with this second wave of an outbreak. We have to thank you so much for coming on Sunrise Daily, Senator, he used to be a senator. He's a medical doctor. Mamora is a Minister of State for Health. Thank you for coming on Sunrise Daily.
Thank you very much for inviting me.